the Gold Coast Health and Knowledge Precinct, our people are transforming lives through healthcare innovation, new knowledge and next generation technologies. We're equipping clinicians with an innovation mindset to become change agents in our hospitals and health tech entrepreneurs, with customised entrepreurial training, access to expert mentors, exploring the power of data and introducing commercialisation know-how. This is the Clinician Entrepreneurship Change Agents Program.
I would like to see clinician entrepreneurs who are confident, who are capable, who are excited.
Healthcare desperately needs innovation, starting to reach a peak in terms of productivity, and that's a combination of both the financing and also the number of people.
It is a long journey. It doesn't happen overnight. I don't think people plan to be an entrepreneur. To be a clinician entrepreneur, I think the key element is passion.
We want to provide people in hospital with a virtual reality experience accessible from the bedside. We know that the use of VR can help to reduce pain, improve function, reduce stress and anxiety.
The project I'm working on is a redesign of like an arm head holder for medical imaging that will help reduce patient motion.
So basically we're creating a cell and rehabilitation therapy for spinal cord injury, using cells from the nose to transplant into the spinal cord to regenerate the injured spinal cord.
I want to innovate how we design insoles and specifically foot orthoses for people with diabetes. Every 20 seconds someone in the world is losing a leg because of diabetes. There's a definite market.
The clinicians and allied health who consistently work with patients day in, day out, they know the clinical problems that need to be solved.
What I'd like to do is develop, using our existing IMR program, an algorithm that could predict or give predictions to the doctors of which pathways a patient might be best suited to return home.
Our clients are persons with dementia or people that have cognitive difficulty. So in that space, my idea was to have a dementia pathway app, be able to support them with resources and be able to outline the type of documentation that they'll require as they journey through and progress through dementia.
We have recognised a need for palliative care clinicians to be able to recognise spiritual distress amongst their patients. Our experts at Karuna, our spiritual care practitioner and grief and loss counsellors and social workers, have developed Australia's first spiritual health first aid course.
I'm the inventor of what is now an enterprise system within Queensland Health called Mask Helper. Basically predict what mask should fit a person based on their face. With almost 97% rank 1 accuracy. We all remember when COVID happened, a lot of healthcare workers were dying. I did lose a colleague in the UK from it, and that was a big shock.
There are many things that have enabled me to become a mentor for clinicians wanting to get into either entrepreneurship or intrapreneurship. I had to navigate the healthcare system from a commercialisation point of view, and we created an innovative Netflix for nurses.
There is a cohort of students who are interested in creative careers in medicine. They essentially want to do more outside of the consult room and make a bigger impact on the world, myself included.
I've found that the pitch is a very big and important step.
The journey to get there in the lean startup and learning to pivot.
I thoroughly enjoyed completing the CECAP program. Then we've received funding to roll this VR program out across 6 HHSs around Queensland.
Now have clinicians who understand some of the terms and wordings within business, understands the financial practices of businesses, understand the customer discovery, design, and also business model canvas. One thing I did see was a change in people's attitudes, a change in their own self-belief that they could do it.
So our tremendous clinicians within our hospitals every day see opportunities to innovate. What the Clinical Entrepreneurship Change Agents program gives them the ability to be educated, to take those ideas and commercialise into programs like our Lumina X Health Tech Accelerator.